Hi everyone. Hi, my name is Vaideshwata and I am the founder of Ayush for Life Ayurvedic Holistic Wellness Center in Canada. We are celebrating mothers, and today, in continuation of our healthcare series on women's health, we are calling all the Ayush professionals coming from different background to talk about most common problems in women's health. So today we are calling Dr. Zahida, who is an Unani expert from India, to talk about a very common topic, which is secondary infertility, and share her wisdom. So I'm going to invite her. Please be with me. And in the meantime, I welcome all the live participants who are watching us. In Ayurvedic texts, the women's importance has been laid. There are so many references that we find in classical Ayurvedic texts where the acharyas have highlighted about women's health in terms of Rajaswala Paricharya, Ritumati Paricharya, Garbhini Paricharya in various stages of life, right? And so today, when we talk about women's health, secondary infertility comes more than often. The marriageable age of fertile women, that is increasing past 15, 20 years, right? And that has been one of the cause when it gets difficult to get pregnant by the couple. So let's take a closer look, in this topic, how Unani medicine, how those basic principles can help, and how Unani medicine can help support these couples who are suffering from secondary infertility. So I see Dr. Zahida has joined, and I'm going to invite her in a few minutes. Dr. Zahida from India. She's a Unani expert, Ayush holistic healthcare practitioner, having tons of experience in the industry, supported so many couples, especially with secondary infertility, and she has joined us. Namaste, Dr. Zahida.
Namaste, how are you?
I am
Can you
great.
see me?
No, I can't. I'm sorry. Your screen is okay. Now
Okay,
I
no
can see
problem.
you. Thank you so much.
Yeah.
Thank you so much for giving your precious time, Dr. Zahida. And I am very thankful that you came in. As I was introducing the basis of this, holistic healthcare series, where we are inviting Ayush healthcare practitioners from different parts of the world to come and talk about the most common healthcare topics in women's health. So
Yeah,
today we are going to talk about secondary infertility, and
exactly.
you yourself being an expert and supported so many families using Unani medicine. Please share your wisdom. Over to you.
Sure. And it's my pleasure that you called me here. And I was watching all your lives, which the series for mother, and it was really great that you are helping so many women all over the world. So we'll start.
Yes, please.
Uh, Infertility, as we all know, it is defined as the failure of a couple to conceive after at least 1 year of regular coitus. So, this is the basic definition of infertility. But today, as we are going to talk about secondary infertility. So, secondary infertility is a little bit different from infertility, because if you are infertile and you are not having any child, then it's like primary infertility. But in secondary, that you already have a single child, or you are already a mother, and now you are trying for another baby. So
True.
it's little bit different, and I think it's more difficult. Then you already have something in your mind, and then you want to plan another one, and you have some, like something about your family, like how many kids we will have, and things like that. Okay, so now, as you all know, that and I want to speak this out loud, that conception, it totally doesn't depend upon women.
Yes.
Conception depends on the fertility potential of both
True.
male and female partners. And this is a very like it's always said that women are responsible for infertility, but it's not. Both have some other problems. But today,
Absolutely.
as we are celebrating motherhood, and we are celebrating women, so we are going to talk about secondary infertility in women. Okay, but infertility is because of male partner as well.
Yes.
So let's start.
What are the
I'm a little
prime?
bit, yeah.
Sorry, go ahead, Doctor Zahida, please.
No, it's been high time, so I'm feeling a little bit nervous.
Don't be nervous. Like, we have our audience, those who love us, those who watch us live, or
Yeah,
maybe
yeah,
after the recorded session. I'm sure they understand, coming out and discussing this very important topic. It builds up. It's very very important to discuss this, especially from a
yes,
perspective
it's
of a
important.
mother. We both are in the same boat, and
Yeah,
we understand as from a mother's perspective as well as a practitioner's perspective. So,
yeah,
Dr.
exactly.
Zahida, let's talk about what are the common causes of secondary infertility. I see in my practice a lot women coming in. They have very very high time. They have very difficult time in conceiving after
Yeah,
they have their the older kid almost 7 to 8 years, and they are trying for past 2 to 3 years. So
yeah.
talk us through, like, what are those main causes and what can people do, a couple coming in mid 30s,
Mm.
and what advices, top tips would you give if they want to want to conceive or have a second baby?
Okay, so that's what I was trying to start with. That although we are not talking about it very often, but secondary infertility is millions and billions of women are suffering from this disease. But it's not common topic, especially here. We are like very shy in speaking such kind of
True.
things.
True.
So it's a very common disease which is prevailing nowadays. That as you started now, I just heard you saying that it is because of age that women, yeah. So the main cause, as I come to causes, the main cause is increased age. Before it was like that, in our country, especially in India, girls get married around 13, 14 years, 15, 18 years maximum. But now as people are getting more educated, and the girls are preferring education, so the age of this motherhood is increasing.
It's
So
increasing.
yeah, this is the main cause that increased age, mostly because of when they pursue some educational course, or they go for any job. So mostly women are like that, they try to conceive after they're 30. So that's the main reason. If you conceive before 30, it's easier to conceive, and after that age, it becomes little bit difficult. And then when you are working, the stress is there, lifestyle is not good. So there are so many factors
Many
with
factors.
increased age. So the main thing is this. Then as a doctor, we all know ovulation. The ovulation problems are there. The disorders like PCOS and thyroid, and because of that,
True.
the yeah. So ovulation is one of the cause. Then fallopian tubes, mostly women come with blockage in fallopian tubes, so that becomes another main reason. Then uterine problems like endometriosis, fibroids are there, polyps, and there are so many uterine problems are there. So because of that also, infertility comes into it. And the main problem in secondary infertility, if I say that, the scars in the uterus because of
True.
previous
Previous.
operation,
Yeah.
previous C-section.
True.
Because of that also in the secondary infertility comes into existence. Then there are so many kind of infections like sexually transmitted diseases, UTI, and PID.
Yes.
That is also a major cause. Then we have um, these kind of these are the main causes. And then
True.
in our field, some causes are very irritating, like they are idiopathic. We don't know why is this happening.
Yes.
So there's some causes which are there are some causes which are unexplained, and we don't know that everything is coming normal, still the couple is unable to conceive.
Yes.
So those causes are also there. If now if I talk about Unani, because I'm
Yes.
Unani doctor, so
Right.
yeah, so according to Unani concept, if I say that I already we discussed now before that Unani depends upon four humor theory. So there may be some kind of alteration in any kind of humor in the body, because we take whole body. We are not focusing upon
Absolutely.
reproductive organs, or we take whole body as the cause. So alteration in the in any of the four humor, the dam, balgam, safra, soda. So we talk about that also. And then we have uterine temperament. Uterine temperament is like every organ has its own temperament. So uterine temperament alterations may also cause infertility according to Unani scholars. Then we have hardness of uterus. Sometimes uterus become hard. This is our concept. I don't know about yours, modern or something. So I know that there comes that I believe that endometriosis is like related to hardness of uterus, because the layer is becoming thicker or something like that. So hardness is there. Then irregular menstrual cycles are there. It's the main cause. Then according to Unani, we also focus on birth defects. Like birth defects are there in modern concept as well, but we focus more on birth defects. That what are the causes? Like sometimes women are not have good birth weight, and then they eventually they are thin, and they are not having like their body is not capable to conceive. Sometimes it goes like that as well. And then discharges, which we take very seriously, white discharge or any discharge from any kind of infection. So vaginal discharges are there. So
True.
that is
True.
one of the cause. And I already told in modern, as we say that STD, yeah, sexually transmitted disease are there. In Unani also, we believe that gonorrhea and syphilis are main cause of infertility.
True.
So, and one of the very important is that the hostility of cervical mucus is there. It decreases sometimes, and that becomes a major cause, because in Unani we believe that cervical mucus plays a very important role, and
True.
it keeps the sperm there in it
Yeah.
until the egg becomes well good enough to come out, and they fuse together. So that cervical mucus cause is also there. So
Right.
these are some Unani causes as well.
And as per my understanding, Dr. Zahida, it comes out to be you find the root cause, in every
Yeah,
particular case, and then treat that cause, and then, eventually the output comes, which is in this case is, the conception happens,
yes,
right? Right. So there are so many. Interestingly, I wanted to share, the Ayurvedic perspective too over
I,
here.
yeah,
When I
I want to hear that.
Yes, yes. I will be sharing that. So, Dr. Zahida, as per Ayurveda, again, it comes to all holistic health. It doesn't, pertain
Yeah,
to the reproductive part of in a woman's body. And
exactly.
just like you mentioned that woman is not responsible for, just for the being fertile. It equally
Yeah,
happens with the male as well. And acharyas, 5,000 years back, they knew this concept, and that's why they introduced therapeutic panchakarma therapy for both the partners. When it comes to the preconceptual regimen and ritual, they wanted both the partners to set their mental makeup, go for these cleansing
Yes.
therapies and then get, in contact with each other and then, conceive a baby. So
Yeah, exactly.
in Hindi or in Sanskrit, they say that, for the Utkrisht Santan Utpatti, which means the best
Best. Mm.
healthy progeny comes when both the women and the
And
male partner, they have the right mental setup when they come in contact with each other. This was the
exactly,
beauty
exactly.
of Ayurveda. And also when,
Absolutely the same in Unani because we
yeah,
don't treat only the female partner. We are treating the male partner with the female
true,
partner, both.
true,
Even
true.
if we don't find any kind of problem or the reports are coming
Yeah,
all correct, then
yeah.
also, yeah,
Yes, true, true.
also,
We enhance the quality of sperms,
yeah,
the
yes,
health of the motility of sperms, the pH, like specifically catering to the male partner. We do give enhancing medicines that Shukra Dhatu enhancing medicines that
yeah,
pertain to or on that play a good role in the reproductive part of the males and help, even if the partner is like halfway through and halfway they come from the male partner, they come in between and the conception happens. So yes, this is the main principle. The second one I wanted to talk about, there are four factors which is called kshetra, ambu, beej, kshetra, ambu, beej, and the fourth one I'm just on the top of my head and it's just got lost. Okay. The kshetra is basically of the uterine bed where the conception happens. So it needs to be very, very healthy. So
perfect.
we take
Yes,
care of the uterine bed where the conception happens. Then comes the beej part. Yes, the fourth one is beej, of course. The healthy egg, the healthy gamete when the women is ovulating. The egg's health should be at the prime most and should be absolutely healthy. The third
healthy.
one is the ambu. Ambu is basically the nutrient channels that are going to the reproductive part of the female to give nutrients to the reproductive part, and that also pertains to a healthy menstruation. So yes, we look for healthy
Yes,
menstruation
exactly.
patterns in women who wants to conceive again. Many times it happens that after the first kid is 7 to 8 years old, the uterus, as per Ayurvedic principle, gets imbalanced with increased vata dosha. So again, the air and the space element, it is highly imbalanced. It gets enhanced, and we do the therapy, specifically the Basti therapy here. Uttar Basti, we say in Ayurveda, the medical,
Pelvic,
um, yes, the medicated oils or decoctions are transmitted through, the cervical internal os in a very surgical,
okay.
sterile environment, and it's an IPD
Yeah,
procedure. That's
yeah,
the one. And the fourth one is overall health of a woman. So, you mentioned about thyroid, you mentioned about PCOD. These
PCOS,
are
yeah,
we have to clear, all these diseases in order to, maintain that hormonal balance in a woman's body. And that's how
absolutely.
the women gets equally, get involved in fertility, I would say, in
Yes.
starting their
That's why
family.
we are called sister medicines because the concept is so like they are similar. Like what you are saying, it's what Unani says. Same kind of things in different language. So that's why the concept is same.
Yes,
We are treating
true,
holistically. So that's
true.
why. So we believe in the. I'm coming to that uterus part and that you said now that
Yes,
why Vatu something like that.
vata
What you
dosha.
said yeah, yeah, it
Yeah,
increases. I come to that part also and it's same. So it's like we believe something similar. That's
yes,
why we are
true.
yeah. That's why you know that the cases are coming more towards alternative therapists and they are not going to like for IVF, and they are not trying IUI or something else, but they're
True.
coming to us because they know that we have something that we can treat them.
Yes, true.
So that's really it's very good part. Nowadays, people are coming back towards their roots. That's a
Yes,
very good part.
I would agree, Dr. Zahida, and that's why people, they are looking for holistic solutions. They come to us, as an we as an holistic practitioners, we try to support them, and educate them, like what are the basic principles and why we are
Yeah,
doing all these interventions. Why you need to find out, the health of your uterine wall, or your period, why it is necessary. It's not about just giving you some medication, or just implanting
injectable everything.
a fused egg in the uterus. Like there are so many things
Yeah.
that we
They
can
are
do.
forcefully doing the thing, like they are forcefully asking ovary to ovulate. They
Yeah.
are forcing, but we are not forcing. We
Yeah.
are taking care of them naturally. Please, please, please ovulate like that. So we are taking care of them with love. That's why I think that they are listening to us. Maybe.
Okay. Dr. Zahida, my next, section of questions would be your top, 5 tips for women
Yeah.
who are who are in the thought process of, having a second kid, don't know where to start, but still want a healthy kid, healthy progeny. What would be your, 5 tips that you would like to share with our audience?
Uh, I'll say that it's not purely Unani, but
Yeah.
yes, that if I say that the 5 tips, if I I also ask my patients that first of all, you have to manage or maintain your weight, because weight is very important. Ovulation doesn't occur if you are overweight or if you are underweight. So the weight management is
Great.
this must be the first priority, the first tip, that manage
Good
your weight.
point. Good
Um,
point.
so because mostly these days obese women are not conceiving, mostly because of PCOS or thyroid
True.
weight is increasing, or some other issues, hormonal imbalances are there.
True.
So main focus must be on weight management. Then secondly, which I ask my patients is, please don't take any contraceptive pills, or if you are having if you are taking, so stop as soon as possible and try to avoid them, because they create a very negative, they give a very negative impact to the reproductive organs. That's
This
the main, yeah, thing.
very,
And
very
then
important.
yeah. Then third is that the diet. The diet must be very proper, and especially the breakfast, because mostly when we are mothers now, we know that when we wake up, we are waking up for our baby only. Okay, so give her food, feed her, or anything. Or we start with our day with our baby only. Okay, so wake up before your baby wake up, and give yourself some good time and a good large kind of breakfast, and then some time, some peace, some moments which you think positively, meditate, yoga.
True.
There are so many things now.
Oh God. Yes.
So this is the third main thing. Then obviously I asked, like we give khamira and different kind of health potions, and if you are taking multivitamins or prenatal vitamins, they are also very important. So go for that as well if you are if you are thinking to conceive again. So
Yeah.
before conceiving, first focus on your health. Just not
Yes.
go and try to conceive.
Yes.
First, make yourself healthy. So
Yes.
take multivitamins and take a good diet. So this is my another tip. Then
Ah.
the fourth one is that
Yeah.
always
Yes.
take a break. The that robotic life we have now. So go for vacation. Give
Yes.
yourself some leisure time. Indulge in any hobby. So which make you stress free.
Okay.
So because stress is creating so many problems these days.
We.
That's another one. And the last one is that always keep a check on your cycle and on your ovulation as well.
Yeah.
Because when you know that this is a time to ovulate, then if you go, if you go for if you go and try, then obviously there are high chances that you will conceive. So mostly people, what they do, that during ovulation period they are not trying, and during other time they are trying. So that
Yeah.
makes a difference.
This
That is the thing. So
these
these are
are
the 5 points.
these are such an important topics, Dr. Zahida. I am so
Yes,
grateful you shared these tips. The reason, I'm going to reiterate, what you mentioned, first about your weight, because weight, of course, is one
yes,
of those causes that kind of create an imbalance in the body when it comes to reproductive health. True, very true. The second one is contraceptive pills. Now I understand, women in their teens, they have their periods, regularized, and they go to the other, mainstream doctors, and they're the only solution they have is, give them contraceptive pills. This
contraceptive
is
pills.
now your body works, your hormonals get just messed up, and you are just creating a big platform for failures of getting conceived
Yeah,
in the future. So please look out
very
for holistic solutions, because they will give you, I'm not necessarily saying go to a Ayurvedic doctor, go to a Unani doctor,
good
but
of your
look out
doctor.
for holistic solutions.
Yeah,
This
exactly.
is big tip. Like, I would, my request to all those
Yeah,
women
really.
who are,
I also request.
yes, in
Never
their,
take your girls, especially who are teenagers, if they are
yes,
not getting periods and
yes,
they go to gynecologist, they give hormonal pills,
yes, yes,
contraceptive pills, 20
yes,
day, 21-day pills or XYZ.
yes,
So they are matlab, messing up with the body. So
true,
it is making worst, like the ovulation part or the cycle part, or the induced periods are not the periods. I always tell my
true,
I always
true.
ask my, yeah, patients, don't think that you are getting periods. This is fake, this is
Yeah,
false. You are
yeah,
just inducing them, and
yeah.
it's not a period. It's
And
just a something like which is um, just for your mental pleasure. If I say that,
yeah,
okay, now I have my
I got
periods. No,
period.
these are not periods. Exactly,
Yeah.
these are not periods.
Yeah, so
That's the problem.
regularizing those hormonal cycles, that is essential, and look for, holistic solution. And third, not the least, is the diet. Diet is a big part of our,
Right.
being healthy. Either we can be sick or we can be healthy, just, with one basic key element, which is the food, right? And fourth
Yeah.
one is, of course, to cater to your mental health, find some peace time, some me time. You already have
Yes.
one kid, you need that mental makeup mindset, and the fifth one, but not the least, is focus on your health first, and then think about
Go for
having a second baby. Yeah, right. So
it.
think about your health first. How are you mentally feeling? How are you physically feeling? And we have one of the question asked from our one of our audience, Dr. Zahida, for you. She's saying that she skips the breakfast and she only gets time until lunch, right? So, is there something that she can do?
So I just say that you have to make some kind of timetable in your life. Like you have to be disciplined first.
True.
You wake up early, or whatever you do, you can prepare some, like you can cut the vegetables at night so that you can
Meal prep. Yeah.
fast. Yeah,
Save the time.
in the morning you can save the time, but you have to take your breakfast before your bed.
Yes.
That is the
Uh,
mandatory.
Uh, yes, I would again, say that, make some time, conscious effort towards your mental and physical health, because
Really.
you are that, epitome of, strength for your family. If you are not healthy, if you are, mentally weak, and if you are physically not healthy, you won't be able to
Yeah,
help others, right? So please,
exactly.
women out there, moms who are listening to us, teenagers, girls who are listening to us, if you are looking for holistic solutions for your health problems, go out and explore, go to someone who is an expert of the field they are talking about. And,
Go to Ayush.
yes, and listen to Dr. Zahida, like Dr. Zahida, these are so many practitioners uh, out there, in your vicinity, reach out to them. and take care of
Likewise.
your health. Take care of your health. Any
Likewise.
last words, Dr. Zahida, before we wrap up this call for our audience?
Uh, I just want to say that mental health is really necessary when you are going through such kind of emotional roller coaster like secondary infertility. Now. So mental health is very important because mostly women are like that. They only have to suffer. And you know that in India, infertility is treated as a curse, and
Yes,
only women are responsible for infertility.
yes,
So I feel that first of all, your partner must be very supportive, and I also ask partners there, if you are listening, that always support your wife. If you are
true,
going to, as a couple,
true,
always be there for your wife, because
true,
for a wife, the husband is like that. He's the son of her solar system. So because of that, so you have to be there. If the world is against your wife, you must stand by her so that she can go through this mental trauma, and she's going through so much. So she's going through pain if she's taking any kind of treatment also, like IUI, and you also know that IVF, they are not so easy, and you must be there, you must help her. And if the mother, she may suffer depression, she may suffer anxiety attacks during this period, so someone must be there to listen. And I also ask try I also try to like what you say, that request the doctors, the gynecologists there, that always be supportive with your patients. You know, sometimes what happened, that the doctor is like, they don't want to listen, listen to the patient. They don't want to give their valuable suggestions to the patient. Okay, you're coming, you take this medicine and you will be all right. But it's not like that. They want you to listen to them. They want you to give them some, you will be like some very positive. You must be like that, all okay, it will be you will go through this and that, and ultimately you will conceive. It's not like that you are giving some negative remarks, or you are not going to conceive or something, anything like that. Always be positive. So, and for the women also, that always try to be positive, try to see the positive aspects. I'm not saying that if you are having a single child, focus on your child only. No, you have right to conceive again, but still, always try to think positive, that yes, I maybe this is suffering is for a short period of time, and then I'll going to win. That's the thing.
that is such a beautiful note. We are wrapping up this session. Thank you so much, Dr. Zahida, for coming in. I wish you the best, in supporting all the potential clients or patients that you deal
Thank you
with
so
on a
much.
daily basis. Thank you so much. And
Thank you.
we will be tuning in with another professional in our upcoming series. Please stay tuned. Thank you. Namaste.
Okay, bye.